Welcome back and good morning if you've just joined us. This is Expresso here on SABC3. Now, often people complain about headaches, and every one of us have gone through a day where we've experienced a headache of some type. It can either be a hangover headache, it could just be a stress-related headache, or there's other causes of headaches as well. And Franca Cat from PnP Pharmacies is here in studio today to answer those headache-related questions. Franca, good morning and welcome to Expresso.
Thank you.
Franca, we got a few questions through from Facebook, but those are the questions that I'd like to ask as well. So I want to kick off straight away with, what is a headache?
Well, there are many different types of headaches. You get over 200 different kinds of headaches. So it's very difficult
I only
to just
listed
define.
3, and there's over 200 types of headaches.
Yeah, and many causes for headaches, ranging from just normal, totally harmless headaches to very dangerous headaches. And therefore, it's very important to note that if you suffer from headaches very frequently, very often it becomes a chronic condition, you should go and see your doctor, because it can be something dangerous. But then you also get your headaches like tension headaches, migraine, cluster headaches, which is classified as primary headaches. That's not as dangerous as some of the other types of headaches.
Now, just explain tension headaches. I assume it's a headache that just comes from here and you feel it in your neck?
Yes, you're quite right. A tension headache is exactly what the name says. The headache starts, or the pain occurs, because the muscles covering the scalp area, the neck area, and also the muscles that join your jaw here on the side becomes tense and contracts, and that causes the pain. And the reason for that is normally, as I said, it's stress, but it can be physical stress, but it can also be emotional stress that causes it. Physical stress, we often find people that work long hours doing a hard manual labor, or even sitting at your desk, concentrating for a long time on the computer, can cause those headaches. They're normally a dull ache that starts very slowly. Interestingly enough, it's always in the afternoon that it starts. Also more common in women than in men. And people that suffer from tension headaches will tell you that it feels like a tight band around the head. Often the pain is more concentrated on the forehead area, or as you said, in the neck area. But it is a headache that progresses slowly. And another very important fact with a tension headache, it is always bilateral. You'll never find a tension headache. Sometimes you can find you have a headache and it's only on the one side of the head. That's not a tension headache. A tension headache covers the whole head area, very pronounced in the neck.
So if I'm suffering from a headache, do I go straight away to my PnP pharmacy to take something, or is there other treatments?
Yeah, no, look, you can, if you can't go straight away to the pharmacy, have a hot shower. If it's a tension headache, have a hot shower. That will help. Heat pack on the area where it's very painful will help. And being a stress or tension headache, have a rest. Go lie down and rest. But if you can get to one of our pharmacies, go in. There are a lot of over-the-counter medications available. But again, I'd like to stress one very important point. People often will just go in and see, there's something I can take for tension headaches. But your headache medications normally contain more than 2 or 3 ingredients. And all those ingredients can have side effects and can interact if you take chronic medication. It's very important to talk to the pharmacist, to tell the pharmacist, listen, I'm on these chronic medications, or I suffer from a chronic illness. For instance, if you're an asthma sufferer, you cannot take any painkiller that contains anti-inflammatories, nothing like ibuprofen. It's totally contraindicated. A lot of your over-the-counter pain medications in the combinations will have a muscle relaxant, especially to relax these muscles. Yet if you're in a job where you have to drive around a lot, operate heavy machinery, you shouldn't take a muscle relaxant. So people sometimes just look at the main ingredient, which is the painkiller, and they don't notice all the other ingredients that could also have interactions and side effects. So I would always advise patients, please speak to your pharmacist and tell them what medication you're on. Tell them if you have any chronic illness, so that they can advise you as to the right one to take.
And for people who can't get to the pharmacy, you've mentioned take a hot shower.
Take
what
a hot
other
shower.
alternatives are there?
Look, again, tension headaches, it's a symptom of a problem, the problem being the stress. So if you suffer frequently or every now and then have tension headaches, go and look at what is the cause. Try and deal with the cause of the tension, whether it be emotional or physical. Exercise, yoga, meditation, acupuncture helps for that. And then you can, instead of just taking painkillers all the time for the headache, rather see if you can deal with the stress.
Well, Franca, thank you so much for answering headache-related questions. We're not leaving it there. I know you're coming back next week, and we're going to answer migraine-related.
Migraine, yes, migraine, and cluster headaches as well.
Cluster headaches as well.
Yes.
So if you have any questions, send them through on our Facebook wall. We'll definitely ask Franca Cat those related questions about migraines and tension headaches. If you have them, remember to go to your pharmacy and ask your pharmacist for the right medication to take at the Pick n Pay pharmacy. They're very, very helpful there. Now, have you ever wondered how you can get that top billing magazine cover look? Well, the top billing fashion editor, Alexis Chaffee, is here to show us how to get that look.